Would you like to introduce yourself?
Yeah, my name's Peter. I'm 30 and I live in St. Paul, Minnesota.
Welcome. So, Peter, when you first started coming in, what were the symptoms that told you something was wrong?
I had lower back pain. Hard to mobilize. Usually it happen once or twice a year.
Okay, and how long ago was that?
It was about 8 months ago now.
And did you seek other care?
Yeah, in the past years I have seen a different chiropractor. Um, yeah, so I went to a different chiropractor. I also went to the doctor just to see what they would say.
And what did they suggest?
The doctor just gave pain medication and said it was muscle issues. The chiropractor would do adjustments and some other work, but they would never do rehab, and it didn't really solve it in the long run.
And so you came here.
Yep.
And you saw Dr. Lala.
Yes.
And what did he do?
He took exam, basically, about 7 to 10 x-rays, did a number of tests with me walking and standing and analyzing those, just to see kind of what my conditions were.
Okay, and at his suggestion, he also sent you to see me.
Yes.
And what did we do?
We did some muscle testing, strength tests to see where my muscles were, how strong my muscles were, which ones were weak and which ones were strong.
Okay, and so your treatment has consisted of?
Muscle work, massage, also doing stretches on my own time, adjustments by Dr. Lala, and then now rehab work.
Okay, and how has this helped?
It's been a great help. I'm pretty active, so I do running, rock climbing, skiing. I do a lot of other activities that are real active, so it's allowed me to do those without being in pain or worrying about having a relapse spasm in my back.
Okay, so first you came in with low back pain.
Yep.
What made that worse?
I mean, just walking around, it would hurt at that point when it happens. Like I said, it happened a couple of times a year maybe, and I would be laying in bed for at least a day or longer. So I wouldn't go to work, I wouldn't do anything except for lay around and wait for it to recover to some degree.
Okay, and the thing that you had mentioned that you felt pain when you were sitting for long periods of time?
Yep. No matter what, throughout the year I'd always have pain whenever I was sitting a long period of time, either driving pretty much any distance in a vehicle, or when I had to be at work for a long time, I'd have to stand up and walk around frequently.
And you've seen us for how long now?
8 months.
And how is that condition now? Are you able to sit for long periods of time?
Yeah, it's gotten a lot better. There's still times where I feel a little discomfort, but not to the degree that it used to be. And usually it's a lot longer and further in between that I would notice that.
Okay, and since you have this active lifestyle, you've had other injuries while here,
Mm-hmm.
and those have been?
Yeah, I messed up my shoulder skiing, and also had some issues with my mid-back, and also I smacked my knee real hard on one of them, which caused some low back pain as well. So
Sure. And has chiropractic helped those also?
yeah, yep. I think chiropractic, but also just stretching, because I would notice pain go away when I'd stretch my knee, and the pain in my back would decrease quite a bit as well.
Wonderful. So you're working well with self-care
Yeah.
as well. What would you tell somebody who's considering coming to this clinic?
I would say they do things a little differently than regular chiropractors. They don't just take one shot of your low back and then decide what to do from there. They take a more broad, bigger picture of what's going on, take a look at what it is, and then decide to move forward there or not. And they don't do as much cracking as the other chiropractors do, which sometimes would help and sometimes would make it worse.
Wonderful. Thank you. Do we have your permission to share this information with doctors, students, and patients everywhere, as well as general public?
Yes.
And any restrictions on sharing this tape?
No.
Thank you very much.
You're welcome.